So just so you know, all of these presentations are going to be made available. They'll be posted probably in less than a month or so on the digitalhealthsummit.com site. So just to let you know, if any of you missed any of the earlier ones or are going to miss anything later, which we hope you're not, you can catch those videos. We'll also have the presentations available made in about a week or so. So our next session really fascinates me. Can technology really motivate people to stay healthy? It's a hot topic, and it really speaks to this quickly evolving relationship people have with technology and how incentives fit into the equation of motivating us to stay healthy. Can technology help influence us to maintain better health? Personally, I know being accountable to someone or something really helps me stay on track. So let's see what our experts have to say. This session is led by Liz Boehm, health analyst with Forrester Research. Liz leads Forrester's healthcare and life sciences research community. Her work helps health plans drive administrative efficiency and loyalty, as well as uncover emerging best practices around technology-mediated wellness and disease management. Liz also leads Forrester's research on Healthcare Unbound. These are the technologies that work in, on, and around the body and can do away with the need for care in a traditional hospital setting. It's all yours.
Thank you. Good afternoon, everyone. We have a full house. We've seen, for those of you who've managed to stay through earlier sessions, we've seen a lot of really interesting, really cool solutions. And we heard somebody earlier say he's been tracking the market for 2 years and watching things evolve. Well, I've been tracking this market for about 10 years and watching things pretty much stagnate. I'm going to be a little bit of the pessimistic voice here to counter the panel. Not because I don't believe in this market. I strongly believe in this market. It has huge potential. And watching some of the innovations that we just saw from Qualcomm, it gets my heart beating. It's so exciting to think about these things. But when Don says what mobile has the potential to do is make things happen faster, it presumes that those things would happen at all. And that's what we're going to look at in this panel. We're going to look at how people motivate or don't motivate, how to get people engaged with their health that just happens to be on some sort of technology platform. We're also going to look at the ways that the technology sort of changes some of those motivations and opportunities. And rather than have me read people's bios, what I've asked is for each of the panelists to do a quick introduction. And so I would like to start with Michael from Bayer.
Hi, my name is Mike Mathews from Bayer Healthcare. I've been working in the diabetes space quite a short time, only about 6 months now. And I also find it very, very exciting to be here. What I thought I'd do is I'd put up a few charts together. Are the charts up, or can we move them forward? Just to kind of get the dialogue started a little bit and some of the thoughts.
Which one is you?
I'm the first one, I think. That should be it. No. No. So anyways, while we're getting those charts up, maybe I'll tell you a little bit more about my background. I can talk about that without a chart. I've been working with Bayer for over 20 years, actually, but in a lot of different spaces. I actually started out in consumer products, have worked in OTC, the pharmaceutical industry, and now diabetes. And one of the challenges that we're facing in diabetes is the fact that it truly is an epidemic in our nation. And what are we going to do about it? And we can sit and either be part of a solution, part of the problem, or we can work hard to become part of the solution. There, if you could just flip to the first one, that's fine. That's it. Can I control it? Let's see. There we go. And I take this headline from Forbes magazine, that diabetes is killing our economy. Today, 18 million Americans have diabetes. But even more staggering is the fact that 77 million people are considered pre-diabetic in this nation. That means that they're susceptible, they may contract this disease within the next 5 years. And this currently costs us $116 billion as a nation. 27 billion of those dollars are direct costs, and almost 100 billion in indirect costs for comorbidities like heart disease, stroke, kidney failure, blindness, amputation. So what are we actually going to do about it? And how are we going to prevent this? Because if we don't, in the next 20 to 30 years, It's predicted that almost a third of Americans will have diabetes and that these costs will more than triple to over $350 billion. And can we afford that as a nation? And we can see it around us every day. We can see it in overweight and what we eat and the behaviors that we do, especially for type 2 diabetes. If we look at this and we say that these costs are going to be too great, then we have to ask ourselves, how do we change? And because this is primarily a behavioral-based epidemic, that makes it quite difficult because we all know changing behaviors are pretty difficult. How many of you made a New Year's resolution, for example? Today's January 7th. How many of you already broken it? So, you know, it's hard. But the truth is, the Look Ahead study, you know, showed that diet and exercise can be even more impactful than medications in this field if we want to prevent or change the course of diabetes going forward. But also important is that we can use technology to help create the information and motivation to change this as well. And we did a study a while back last year called the ACT trial. And what it did is really just showed if we can break down some of the barriers, if we can make things a little bit easier and get people to do the right things, testing before and after meals, so that they really understand the impact that food is having on their blood glucose, they can take the steps to then stay within control and optimize that going forward. So if you give people the right information, if they motivate it then to use that information, and they have the behavioral skills to use it effectively, they can really change what they're doing and have an impact and improve their outcomes. And you know, at Bayer, we have the theme Science for a Better Life. And with that comes obligations. Obligations to really kind of focus on doing the right thing for both patients and healthcare professionals and investing our resources in the right areas. And so one of the areas that we're really focused on today is creating devices and tools that are going to help provide better information to patients, to help break down these barriers so that they can track their trends better, so that when they go to their physicians physicians can plug in and get much more information about the patient to give better direction for those patients going forward. And so this is our Contour USB, which you see there. And I thought maybe I'd just let you pass this around so you guys can take a look at it. And if someone would just give it back to me later at the end of the session, hopefully. And then I'll pass this on. Thank you.
Great. So now we're going to hear from Rod from Ant Plus.
Okay, hi there. I represent the Ant Plus Alliance, and what that is a consortium of like-minded companies that are interested in starting to do what this panel is talking about, I think, today, which is measuring the health and fitness of people so that they can make changes in their life. So I'll just go through, just let me click this thing. There we go.
The computer's over there.
Okay. So we have over 350 members, primarily focused on personal area networks. We've been very strong in sports. We've been in the market for over 5 years now. Really strong in cycling and running, and we're growing into the health and wellness and hopefully into more and more home monitoring medical type applications that everyone sees as extremely required. There's such a need right now. So this is a picture showing all of the different use cases, and this isn't all of them, this is just some of them, that we're currently supporting. And the icons around the side are all of the different profiles currently supported by the Ant Plus wireless network, which is the underpinning of what all these companies are using. So what we're really promoting here is a system by which all of these companies who participate can ensure interoperability, seamless transition of devices connecting from one system to another, one network to another, allowing your data to flow where it needs to go. And that is, from the user, from personal measurement while you're doing sport, fitness, or just walking around your house and getting that out to the internet. What has to happen then is that data needs to get processed in a way that gives that user useful